So here we have our first patient for the morning, and as you can see, she's got quite a prominent bump on her nose. It's actually bone. The nasal bone is projecting forward and giving her this bump. But also the cartilage of her nose, this part is also quite prominent, and her tip is quite droopy the way it goes down. So we're going to be doing a closed rhinoplasty where I'm making incisions inside the nostril, and through here we're going to remove the bump and remove some of the cartilage of the tip and also shorten the septum. So let's do the operation, and I'll see you back in half an hour. So here we are, we've come to the end of the operation, and it's literally been only 30 minutes, a little bit less than 30 minutes. And you can see we've removed the bony hump and altered the cartilage of her tip and altered the angle between the lip and her nose. And she now has a much nicer shaped nose, not overdone in terms of the slope, but just a nice straight dorsum with a slight break rising slightly to the tip. So this is what we try to achieve with a female rhinoplasty. And she's just got a few sutures inside her nose, inside her nostrils, and where we've made the access incisions. There is no scar across the columella. There is no scar across the alar base. We haven't had to do those procedures. All done by what's known as an endonasal or closed rhinoplasty. And what we're going to do now is put some tape on her nose and a small plaster, and she'll be able to go home in a couple of hours. And here we are right at the end of the case, and I've put some tape and the little plaster on, and she'll be waking up in a moment, going into our recovery and going home after 2 or 3 hours. Most of our patients are able to start relatively normal activities the next day, and we'll leave the plaster on though for 1 week. At a week the plaster comes off, and it will reveal to her the beautiful nose that we've made underneath.